Hi, Dr. Vincent. You mentioned a study on bevacizumab beyond progression that also came out today at ASCO.
Yeah, so this is a very important study, potentially a landmark study, actually, of bevacizumab beyond progression in advanced colorectal cancer. About 400 patients on each arm here. Patients were treated on a conventional first-line chemotherapy, dealer's choice, which did include bevacizumab, and they had to be on that for at least 3 months, including being on the bevacizumab for at least 3 months. And then upon RECIST progression, they were randomized to a standard second line, which of course would be influenced by what they had in first line, because again, dealer's choice, with or without bevacizumab at a dose of 7.5 milligrams this time. Now, the bottom line here is that this trial, which originally had PFS as the primary endpoint, and was begun under the auspices of the AIO, later changed to Roche with the sample size expansion, and the primary endpoint then became the overall survival. And the primary endpoint here was met, going up from 9.8 to 11.2 months with a hazard ratio of 0.81, and the PFS, which is now a secondary endpoint, also being positive, going up by about 1.6 months, from 4.1 to 5.7 months, with a hazard ratio of 0.68, also being positive. And the p-values associated with both the survival benefit and the PFS benefit were highly robust. There was an increase in the disease control rate, which, as you would expect, would knock on to a PFS and thankfully a survival benefit. The side effect profile is to be expected from bevacizumab, but nothing particularly onerous about it, I think very manageable. The question being whether or not this should represent a new standard of care, bevacizumab beyond progression. Certainly there was an opinion that perhaps it should, although there were issues around the affordability of treatment as usual. But nonetheless, this is the first prospectively conducted randomized trial of an anti-angiogenic agent beyond progression, having used it up front. And the wider question now really is, would this be applicable, for example, to non-small cell lung cancer, to ovarian cancer, or to other situations where bevacizumab is generally employed, or perhaps even situations where bevacizumab has not been successful because a PFS endpoint might have been met but not a survival endpoint, and now with the possibility to continue it beyond progression, the survival endpoint perhaps now being a more achievable goal. So I think this study will have reverberations throughout oncology and not just in colorectal cancer, and I think there's going to be an interesting debate and discussion around it.